Hello, and welcome to the Hawaii Health Data Warehouse Coffee Break Monthly Webinar Series. I'm Tanya Lowry St. John, the Public Health Epidemiologist with the Hawaii Health Data Warehouse, or HHDW, and research faculty here at the University of Hawaii at Manoa Office of Public Health Studies. We're going to use the next 30 minutes to introduce you to the Tobacco Prevention and Control Plan 2030 tracker in Hawaii Health Matters. The Tobacco Prevention and Control section in the Hawaii Department of Health's Chronic Disease Prevention and Health Promotion Division has been creating data books and strategic plans to guide their work for many years. These were typically 5-year steering documents, with the last version published in 2016. Each new version has sought to combine the latest data with the newest technology to present the most current information in an easy-to-use manner. To that end, the first tracker was created for the 2020 plan, and today we'll be showing you the 2030 plan tracker. These resources have been used by many different stakeholders, including researchers and students, public health professionals, policymakers, educators, media, grant writers, community members, and advocates. But the 2030 plan is also part of something bigger. The Chronic Disease Prevention and Health Promotion Division at DOH set out an ambitious goal to create an overarching plan to harmonize the division's 2030 goals in what they call the Healthy Hawaii Strategic Plan 2030. This strategic plan includes program-specific plans for asthma, cancer, diabetes, heart disease and stroke, physical activity, nutrition, and tobacco prevention and control. And these plans work across plans in the following sector areas: community design and access, education, healthcare, and worksite. The Tobacco Prevention and Control Tracker provides a convenient tool to monitor the state's progress towards a tobacco-free Hawaii and contains about 40 tobacco-related indicators of population health from multiple data sources, including the Behavioral Risk Factor Surveillance System, the Youth Risk Behavior Survey, the Youth Tobacco Survey, SINAR data, CDC Places, and the Hawaii Tobacco Quitline. The data is divided into sections in accordance with the tobacco plan focus areas of disparities, prevention, cessation, and secondhand smoke. And more indicators are going to be added soon from the 2020 BRFSS and the 2021 YRBS data as they become available. The tracker has several features. One of them is a toggle control that lets you easily see the data by state or county level. You can always look at trend data, subgroup breakout data, such as by sex or race, ethnicity, and others where is available. It has icons to highlight comparison data and directionality, interactive maps and charts, links to related data, and as with all of our data in the Hawaii Health Matters, or HHM system, the data is updated asynchronously by source. So as in the past, you would make one document that would show what was going on or what the state was at that time period, and you have to wait for 5 years to get a new one. Now, every year as new data rolls in, we have new data updated in the tracker. There are several new indicators in the 2030 tracker. You can see the complete list here. Two of the guiding principles of the site are to provide data in context so that you have something to compare it to and to make the data easy to understand. We do this by using a collection of symbols and visual cues throughout the site. Up and down arrows are paired with colors. So the color red is bad or moving in the wrong direction, green is good or moving in the desired direction, and blue is neutral. For symbols, solid trend boxes are generally statistically significant trends, and mostly white boxes are not statistically significant. A green check mark means that the target has been met, and a red X means that it has not been met. And for this demonstration, we're going to be focusing on our Tobacco Prevention and Control, or TPC plan targets. So let's work through an example. So here you can see cigarette smoking among Native Hawaiian adults and cigarette smoking among low-income adults. You have the point prevalence for each, 18.9% and 20.2%, and this measurement was done in 2019. They're both about the same statistically as their prior value, and they both have been trending down over time. However, you can see that the decrease in smoking among Native Hawaiian adults has not been statistically significant, while the decrease in smoking among low-income adults has been statistically significant. And you can also see that for both of these, we have not yet met the TPC plan target. This is to be expected because it's a new plan, and so we're set ambitious goals for the next 10 years. Let's get into finding the data. So you would start here at our hawaiihealthmatters.org site. So here you have hawaiihealthmatters.org, and you can see that our featured content this month, if you saw real fast, was the Tobacco Prevention and Control Plan 2030. So you can click on there to get your own copy or to have copy to the plan itself. And you can see here we have our focus on dashboard. This changes monthly in accordance with the featured content. So here we are focusing on the plan and its tracker. We have a link to its tracker here. So it just gives you some quick overview of a couple of these things. You can see those icons that we mentioned before. Though when you come back here a month later, since this does change monthly, this won't be here. So how else can you find it? You can come up here to our track progress, and you can see, since it's our newest tracker, it's here in our first position for tobacco prevention and control. Or if you click on the track progress page, you can also see it's here. These are another collections of trackers that we have, and we should be adding them for more of the Healthy Hawaii Strategic Plan program areas shortly. But here, let's go ahead and click on tobacco prevention and control. So here you can see the 2030 tracker. We have a little bit of background information about the tracker and how it came about. We have links to the plan itself. We have links to the tobacco prevention and control section in the Department of Health, and we also have access linked to the executive summary. After this webinar, we'll add a link to this webinar. So if you need to have more orientation to it, that will be there as well. So scrolling down, you can see that the tracker is divided into indicators about adult tobacco use, priority populations, prevention, tobacco sales, cessation, and secondhand smoke. As we mentioned before, you can see that each of the indicators has a little bit of information plus icons to help you interpret that information. So you can see here, for example, adult exposure to secondhand smoke in cars. That data was last captured in 2018. It has been trending downward over time, but not significantly. But if you take a look at, for example, young teens and teens exposed to secondhand smoke in cars, they have been decreasing significantly over time, but we've set some pretty ambitious targets here of no exposure, so that target has not yet been met. When you're looking at these things and you're asking yourself, I'm not quite sure I remember what these symbols are, it's okay. Go ahead and click on this See Legends button here, and that will give you the key to be able to interpret the symbols. And this is available for you throughout the site. And when you're ready to get rid of it, you just hit hide. Let's go back up to the top of the tracker. We're going to click on this orange button here, and I want to bring your attention to a couple of features. First, I want to show you these here are different readability buttons. So for example, if you don't like this format, you can change it into a tile format, a card format that might be more helpful to you as opposed to the tile view. If the colors are an issue for you because of color blindness or visual acuity issues, you can go ahead and turn on, we have a colorblind mode that gives you the thumbs up and thumbs down. Because if you know that the green means it's going down, but you don't know if that's good or not, well, you see the thumbs up, then you know that that's good. So you can turn those on and off. You can also see here that this is our geography selector, and we're currently set for the state of Hawaii. So if we look here at adults who smoke cigarettes, we have our point prevalence. Our comparison is the median value of the United States, prior value trend, to the Tobacco Prevention and Control Plan, and then also to the Healthy People 2030 target. We've provided those for you when they're available. But let's say I'm from Kauai and I want to see how I'm doing in my county. I can go ahead and select here on Kauai, and it will refresh and now show me this information for all of the indicators for which we have Kauai specific information. These are now available to you. And you'll see here that our comparisons have also changed slightly. So now for adults who smoke cigarettes, it's 11.5% measured in 2019 in Kauai, then compared to the Hawaii state value, which is 12.3%. So again, you can use this feature to go ahead and take a look at the different geographies for which we have data. If the geography does not have data, then that indicator will just drop off of this current version. Okay, so now let's go ahead and dig a little bit deeper. Let's take a closer look at adults who smoke cigarettes. So this is our standard indicator report. Here you can see the title, adults who smoke cigarettes. You can see the locale. Since we were on Kauai, we're still here in Kauai. If I want to change it back to the state, I click on this little arrow and I can come back to the state of Hawaii. You can see the measurement period, it's 2019, and I can go ahead and change that if I would like to as well. The default will always be the most recent, Followed there is a definition. So how do we define adults who smoke cigarettes? It's percent of adults who have smoked at least 100 cigarettes in their life and who report smoking on some days or every day. We give you a brief explanation of why this is important. Again, that's that providing context around the indicator. And we point out that this is a Healthy People 2030 leading indicator. You can see the point prevalence of 2.3%, that our location is the state of Hawaii. The source of this data is the Behavioral Risk Factor Surveillance System. And then we have these comparison icons. And as I mentioned before, you can pop out the legend, or when you're in an indicator, you can just hover over each of these to get more information. You can see we have trend data here, and we have some charts. Whenever you see our charts, you can click on this little 3 bars, which we affectionately call the hamburger, and you can do some work here. If you want to go ahead and add confidence intervals to the chart or enable zero-based values, that's available to you. And then you can go ahead and then download that chart as a JPEG, a PDF, or you can download the underlying data as a CSV file. So those are some options that you have for you. Besides the trend data that you have, you can see that we have, for this indicator, data is available by subgroup. We can click on these to open them, and you'll see that the color scheme that we talked about before applies. So here, for example, when we look at cigarette smoking by age, blue is neutral, so there's no significant difference to the state overall value. Red is bad, so they're significantly worse than the state overall value, and then green is good, significantly less than the state overall value. Again, you can hover over any of these to see the underlying data. You can also download the data if you click on the hamburger. So we'll just keep scrolling down here so you have a quick view. So now I can look at not just adults who smoke cigarettes for the state overall trend, I can now see what it looks like by age, by education level, employment status, federal poverty level, race, ethnicity, and any of the different subgroups that are available for you. And they do vary by indicator and data source. So please feel free to take a look. Okay, so scrolling down after I can see then the data and the trends, point prevalence trends, and then what it looks like among subgroups, I have the ability to look at the data by geography, where those geographies are available to you. So here, let's go ahead and take a look at the data by county for adults that who smoke cigarettes. And then I can see here, this will give me my map feature. And so for this tool, I have a map, a bar graph, and a data table. These are all connected so that when I highlight one, the other two highlight so I can see the underlying data values. Again, this can be exported. And I have the ability to compare this data. So the default is ranked, so you can see which one has the highest compared to the lowest, but I can go ahead and take a look and say, let's compare it to the Hawaii overall. So I can see that Maui County and Hawaii County are higher than the state as a whole. In this case, I can also go ahead and take a look at how it looks compared to our plan, our target plan. So again, if that's something you can export that, if that's helpful to you. We can also go ahead and take a look at, for example, compared to the prior value or trend over time, so that I can see here that while Honolulu has gotten significantly better, Kauai, Maui, and Hawaii have not changed significantly. They're better, but not significantly over the last period of time. And again, I can hover over each of these to get some more information about what that means. For something like this, adults who smoke cigarettes, this is one that we share the data with our state BRFSS data and the CDC Places data. Data is available at the zip code level and all the way down to the census tract level. So if you're trying to do some local community work, this is available. This is not a feature that's available for all of our indicators. It has to be only some of them that are CDC Places. So that's but it's a neat option to have. And again, you can always expand out this chart. You can download it. You can do some features here as well. So it's a neat little tool. Okay, so scrolling down then, the next thing that we have with our standard indicator reports is that we have that related content. So you can see for adults who smoke cigarettes, you can see additional indicators that may be of interest, reports, data sources, and whenever you see this little more, we have a default for 3, or we can have the Tobacco Prevention Control Plan for 2030. They're both here. But if you hit on the more, you can see that we might have a lot more information that's related to cigarette smoking that may be of interest to you. You can click on any of these indicators to do some more research. So going back to our standard report, I'm going to scroll back up to the top and say, when I looked at this data, all the data that I saw was by one dimension only. So I look at the data by year and, for example, race, ethnicity, or sex, or so forth. What if I want to do a little bit more in-depth analysis on adults who smoke cigarettes? For our indicators that are part of also our Hawaii Health Data Warehouse, if you click here on the data source, it will take you to the actual report in our Hawaii IBIS system, our HHTW system. And if you've seen some of our previous webinars, you'll notice that then we can go ahead and modify this query definition at it, and then we can look at it by sex and race, at least 2 dimensions. So that's available to you as well. So coming back to the tracker, the Tobacco Prevention and Control Tracker is an easy tool to be able to see how we're doing in the area of tobacco prevention and control, our priority areas at a glance, and to be able to dig down and get some more information. Which priority population has the highest proportion of cigarette smoking in Maui County? How about Hawaii County? How is frequent e-cigarette use among teens defined? Which race ethnicity has the highest frequent e-cigarette use among teens, among young teens, and what about among teens? And compare the quit line awareness by age and county. All right, our first question was, which priority population has the highest proportion of cigarette smoking in Maui County and in Hawaii County? So here we would go ahead and just set it to Maui County, and we'll wait for it to refresh. And now we can see here are priority populations. So for Maui County, we can see that the highest rate of cigarette smoking among priority populations is among unemployed adults, where 44.2% of people who are adults who are unemployed in Maui County smoke cigarettes. And we'll go back and we'll take a look at what it looks like in Hawaii County. And you can see here again, we can just quickly scroll down and see how Hawaii County is doing. And we'll see that actually theirs is higher, 31%, and among adults with depression. So 31% of adults with depression in Hawaii County are current cigarette smokers. The next question is, how is frequent e-cigarette use among teens defined? So I'm going to scroll down here, and I see that we have teens who frequently use e-cigarettes. So I'm going to click on that indicator. And then when I open this up, I will see here we have the indicator definition, which is it's the percent of public school students in grades 9 through 12 who use an electronic vapor product or e-cigarettes, vaping pens on 20 or more of the past 30 days. So e-cigarette use is 20 or more of the past 30 days, frequent e-cigarette use, and teens are grades 9 through 12. We'll see in a second that in our system, young teens are grades 6 through 8. Our data source here is the Youth Risk Behavior System. So the next question is, which race ethnicity has the highest frequent e-cigarette use among teens and young teens? So I'll go down here for our teens and I'll click on race ethnicity. And then I can see, oops, I'm in Hawaii County. So I'm going to come back here and look at it for the state. And then I will see here that for race ethnicity for the state as a whole, the highest is Native Hawaiian teens, 17% frequently use e-cigarettes. Now I can come, if I want to do young teens, I can go back to the tracker. I can actually start to type in the keywords here and it will show me. Or I know this is going to be related to young teens who frequently use e-cigarettes. So I can also click down here to get to the other report. I'm interested in state level data. Again, I can see that definition has changed to grades 6 through 8. So when I'm talking about young teens, I'm talking about teens grades 6 to 8. You don't have to memorize it. The information will always be there for you. And then again, by race ethnicity, it's going to be pretty much tied between Native Hawaiians, others, and other Pacific Islanders. These are all high, but none of these are statistically higher than the state as a whole. Then my last question is, compare the quit line awareness by age and county. I'll go ahead and I'll type in quit line. So adults aware of the Hawaii tobacco quit line. So here I can see the definition about it's adults who know about the quit line. And then I can see that overall it's 64.1% of adults report that they have heard of the Hawaii tobacco quit line. They're aware of it. It's significantly higher among adults who are aged 25 to 44, significantly lower among our older adults. And then if I want to go down and look and see how they are by counties, I will click on our county data here. And I can see here that they're pretty similar. It's going to be lower if I want to compare it to the state as a whole. I can see that it's lower in Hawaii County and about the same across the other counties. Thank you for attending today's webinar. Please join us in April for our next webinar, where we'll walk you through the new and improved hhtw.org website. We've completely revamped the site to make it easier than ever to get you the data you need. In May, we'll be featuring the Oral Health Tracker and Hawaii Health Matters. We'll see you then.